Hi everybody, welcome back to the channel. We are talking about the 5 M's of managing diabetes in pregnancy. So let's just jump right into the first M, which is measurement. And that seems kind of obvious, but you can't improve what you're not measuring. So you need numbers to look at. And we're not just treating the numbers. We definitely want to look at all of you and how you're feeling and how your baby is doing. But we need to start with these numbers to get a sense of where we are. You can measure your glucoses with a glucometer where you do finger sticks every day, and that's been the gold standard of measuring glucoses pretty much forever. It's the most accurate way to get a sense of what your body's glucoses are doing, but now, more often than not, we are also offering people continuous glucose monitoring, and that comes in the form of a Dexcom or a Freestyle-like monitor, and these monitors you can wear on your arm for 10 to 14 days at a time. They will measure your glucose every minute or two and either send them directly to your reading device or your phone, or you can scan them with your reading device or your phone. And these numbers will also either automatically be transmitted to your doctor's office, or you can bring your reading device or your phone to each doctor visit so that together you can look at your glucoses, see what's happening in the middle of the night, see what's happening in between meals, and a result of the different foods that you eat. It gives you so much information. Continuous glucose monitors don't eliminate the need to check a blood sugar every now and then. Sometimes your meter will tell you that your glucose is going high or going low, and in those cases you need to check a blood sugar, and many of these continuous glucose devices will allow you to calibrate the reader so that it gives a more accurate reflection of what's going on with your blood sugars. Most OB providers want you to check your glucoses first thing in the morning, get a fasting glucose before you have your breakfast, and then they want you to check 1 or 2 hours after you start each meal. And for your 1 hour value, if that's how you're checking, your glucose should be less than 140 1 hour after you start a meal. And if you're checking 2 hours after meals, your glucose should be less than 120. And for that fasting value, most people use 95. We want your glucose to be less than 95. But in many places, they want your fasting glucose to be less than 90. So it's very important for you to measure these. Equally important for you to write them down if you're using a glucometer, or to bring your device with you whenever you go to the doctor's office so that you can sit down and we can go over these values together. The numbers that we're looking at for gestational diabetes and with type 2 diabetes is that we want your glucose values to be about 90% in range. In other words, 90% of the time we want your blood glucoses to be in that target range. And for a type 1 diabetic, those glucoses tend to be a lot more labile, so we look for an ideal of about 70% in range for those glucoses. Being diagnosed with diabetes in pregnancy or already having diabetes in pregnancy means lifestyle changes. They are at the heart of managing diabetes. And for the measurement piece of this, you just have to develop the habit of checking your glucoses, either with your meter or with your continuous glucose monitor. So that's the first habit to get down and make it part of your daily routine. So that sums it up. That's the first M of managing diabetes in pregnancy: measurement. As always, talk to your provider directly and find out their take on things. If you're interested in learning more about continuous glucose monitors, check out the other episode that we have on the channel that specifically covers that.